Live from the Zimmer Radio World Headquarters in the heart of the Midwest, this is the Gary Nolan Show. Now, here's your proud card-carrying member of the Libertarian Party, Gary Nolan.
Hey, welcome. Glad to have you with us. Glad to be with you. It is 7 minutes after the hour. If I know all there is to know about secondhand smoke and all the nonsense and junk science behind it, this guy apparently knows all there is to know about vaping, or at least he knows an awful lot. It's Jeff Stier. He's with the National Center for Public Policy Research. He's a senior fellow there. He's been on CNBC, Fox News. He's been all over the place. And his op-eds have been published all over the place. And those of you who listen to the program on a regular basis know that my producer entirely quit smoking because he started vaping. And then I started vaping, and I've cut back way back. And in fact, I think it's a great way to quit smoking. But the federal government is going after these companies that make e-cigarettes and the vaporizers, and I ultimately think they're killing people. Jeff's got a piece that he contributed to, and he's with us this morning. Jeff, welcome to the program. How are you?
Hey, Gary, good to be back with you, and congratulations on cutting back your smoking using e-cigarettes. The federal government doesn't want to even acknowledge that reducing the amount of smoking is a health benefit. That's how ideologically distorted their point of view has become.
I can't even... there's a company here that... there are two companies here in town that advertise with us, and I can't get on the air and say, I quit, or somebody I know quit, or you can try to quit, or this will help you quit, because the government won't... These regulations won't let us do that.
That's exactly right. And what's worse, if things don't change, and I'm hopeful that under the new FDA commissioner nominee, Scott Gottlieb, things will change, and we're working hard at that. In fact, tomorrow in Washington, D.C., I'll be part of a panel at the Heritage Foundation that will be discussing this topic. It'll be live-streamed at heritage.org. And what we're going to talk about is the need across the federal government, as well as local governments, but certainly across the federal government, to change the approach to harm reduction, to make sure that when the Centers for Disease Control does studies on the topic, that it uses accurate science rather than distorting the science to scare people about youth initiation. They're trying to put out this narrative that kids are trying these products and then becoming smokers, and the science absolutely doesn't support that. Yeah. And we'll have on hand tomorrow Dr. Sally Sattel, a scientist, a psychiatrist from Yale, who is a fellow at the American Enterprise Institute, by the way, a colleague of Scott Gottlieb, the new FDA commissioner nominee, to talk about the science and the studies on it. But it is clear that use of e-cigarettes is not a gateway, that kids who may become smokers and may have tried an e-cigarette first are those that would have become smokers anyway. And in fact, those who would have become smokers anyway, some of them actually don't become smokers, and they use e-cigarettes, which are dramatically less harmful. So it's a win on both sides of the coin in terms of youth use of these products. In fact, when the Surgeon General, and we need a new Surgeon General, because the one who put out the Surgeon General's report last year only focused on the risk of e-cigarettes to youth and didn't weigh the other side of the equation, which is the benefits to adult smokers like you and your producer and thousands around the country and around the world who have reduced the amount of cigarettes they smoke. Many have quit entirely. Some still use nicotine, which is certainly addictive, but not the harmful component of cigarettes or e-cigarettes. And across the board, people are reducing their risk, eliminating their risk. Some use nicotine, some don't even use nicotine anymore. They vape without nicotine. And this is a boon to public health. And the government at the CDC is distorting the truth. The FDA is basically banning e-cigarettes starting in under 2 years unless Congress changes the law. And that's going to be the immediate focus. There was a bill introduced last year. It went pretty far. It didn't pass, but we're hopeful that it will pass this year. It really has to save all the, and we could talk about jobs in any industry, but to me, this is about human lives.
All right, Jeff Stier is our guest. If you just tuned in, he is with the National Center for Public Policy Research. We're talking about this attack by the federal government on e-cigs and vaping. One of the things that they do, Jeff, they cherry pick data, and the way they present data are often incredibly misleading. For instance, the percentage of kids who are smoking regular cigarettes, if I'm not mistaken, that's gone down every year.
It's gone down every year for quite a while, but the decrease has actually accelerated. Kids are smoking less and less, especially over the last 5 to 10 years.
All right, so
Yet if you look,
if e-cigs and vaping were a gateway to tobacco use, wouldn't we see that going the other way?
well, the CDC tells us that there is a startling increase in the use of e-cigarettes among youth. And they also suggest that it could be a gateway. So if there's this startling increase, by the way, they're only referring to once in the last 30-day use. So a kid may have tried it, and all of a sudden they're a vapor. They're someone who vapes. But even if you take them at their word and say there's a startling increase, well, of course there's a startling increase. These products weren't on the market a while ago. So it's like saying there's been a startling increase in iPhone use over the last generation. Well, duh. But the question is, does using an e-cigarette cause a dramatic increase? Is there a gateway in smoking? And the evidence points strongly in the other direction, that if anything, these products are causing kids not to smoke.
That's just an example of how they contort data to make it look like something that it isn't.
Yep.
There is not a product. You know, a toxicologist will tell you the dose makes the poison. There is not a product in the world. I don't care if it's oxygen or water, if it's nicotine. There's not a product in the world that you can't abuse to death. No product is 100% safe under all circumstances. Would that be a fair comment?
Oh, you're 100% right. That's something that the left, always hungry to regulate more, often tries to hide from us, but true.
So, you know, you can't come out and make a statement that under all circumstances, 100% of the time, e-cigs are absolutely safe. Because there are ways to abuse everything from water to air. But they are incredibly safe compared to cigarettes.
And that's exactly the comparison. Look, if a young person comes to me and says, hey, maybe I'll start vaping, the first thing I would say is, well, do you smoke? And if they say no, I would say, well, maybe you shouldn't start using an e-cigarette. If a smoker, an adult smoker, comes up to me and says, hey, I heard all this bad stuff about vaping, should I try it? I would say, absolutely, your life depends on it. In fact, I was recently in Utah skiing, and I was skiing with a couple of ski instructor friends of mine. One was a friend of a friend, and I didn't know what I was going to chat with him about. I figure a ski bum out in Utah, what am I going to chat with him about? And he mentions to me that he that he still smokes. And I said, oh, have you tried an e-cigarette? And this guy was about 50 years old. And he said, oh, I tried once, but it didn't work. I said, well, you probably tried the wrong product. There are a variety of products, a variety of nicotine levels, a variety of battery powers, a variety of flavors. You probably need to go to a vape shop and get counseling on what the right product is for you. It's great. It's like a public health service paid for by the private sector. You ought to go to one. And he said, oh, I'd be willing. So I looked it up, found out that all of the vape shops in Park City, Utah have been banned. They're not allowed to exist in Park City, Utah. God. So what's the likelihood this guy's going to drive 45 minutes out into Salt Lake City to go to a vape shop? It's not going to happen. So this is a devastating unintended consequences of these regulations around the country.
The whole thing on secondhand smoke was a canard. And I know about all the cherry-picked data. I know about all the bad studies. I know about all the flaws in the bad studies. But you could argue that secondhand smoke smells awful, and you might, and you can make that case. But e-cigarettes and vaping, they don't smell very much, if at all. And yet we find that they're banning e-cigs in restaurants and bars around the country, just like they ban smoking.
Yep, you raise a critical point. Now, on secondhand smoke, They ban it. I live in New York City. They've banned it from public parks. In fact, they've banned smoking cigarettes, combustible cigarettes. They've banned it from the beach. And I could understand it smells badly, even though it's not making people sick when you're out at the beach. I don't think anyone argues that it is. But you could say it's just a smell that some people don't like. In fact, if I'm walking down the street and someone's smoking and they're walking ahead of me, I'll just avoid them because I don't like the smell. I don't think it's going to kill me. I don't like the smell. Certainly, there are some flavors and strong flavors, very sweet, strong flavors, in e-cigarettes. And some people may not like that flavor. I don't like heavy perfume smells. But we're not banning them. I think we need a little bit of common courtesy from e-cigarette users if they are in a bar and they're using a strong flavor. Maybe ask if anyone minds, or perhaps do it away from a crowd of strangers. But to have the government come in, you and I are both libertarians, we understand why that's problematic. But on the side of the vapor, I think they should also exercise a little bit of personal responsibility and recognize as a courtesy that it may bother some people, and we'll probably all get along a lot better.
Yeah, you're absolutely right. The building owner or the property owner, the business owner gets to make those decisions. But here's the downside to banning it inside a building. A lot of smokers are going to say, look, if I got to stand outside with the guy who's smoking a real cigarette in the cold, in the rain, and all that, I might as well smoke a real cigarette. There's no advantage.
In fact, absolutely. I testified in Los Angeles at a hearing where they tried to ban vaping in bars. At first they were trying to ban it in public places because they were worried kids would see it. And they made this convoluted argument that it would normalize, that was the word they used, normalize smoking. They would say that e-cigarette use normalizes smoking. That in itself is absurd. But they said if we're going to allow people to vape in public, then kids might see it, and it might normalize smoking. Well, what they did was, in Los Angeles and other cities around the country, they tried banning it in bars where there aren't kids allowed, forcing former smokers to go outside in public, where kids could see them, and vape in public, and then they're going to be standing there with their buddies after having a drink, and they're probably going to go back to smoking. So these are more examples of these unintended consequences. The other side claims that they're trying to promote public health. In fact, with all of these regulations, whether it was what I saw in Park City or what happened in Los Angeles or is going on around the country, they ignore the downside.
All right. So you had too many cigarettes today, didn't you? So what can listeners do?
So right now, the most immediate and impending issue is this legislation that would undo or change a date in this FDA rule. It's called the deeming regulation. It's not as complex as it sounds, but basically it would change the grandfather date to exempt products from this regulation that existed years ago. Right now, the FDA wants to take all of these products off the market unless they go through a very complicated and expensive and perhaps impossible to prove test. So what Congress is trying to do, and I think they have the support to do it, but everybody should call into their local member of Congress and senator and make sure that they support the so-called Cole-Bishop Amendment to change the grandfather date so that the FDA will still, the left is warning us that this bill will cause e-cigarettes to be unregulated. False. E-cigarettes are banned for the sales to minors. There are all sorts of regulations, both at the local and federal level. But what we want to do is we want to make sure that adult smokers still have access to the products that are on the market today, that they shouldn't be pulled from the market. And that is kind of the immediate concern. And we're going to be talking about that more tomorrow at the Heritage Foundation event, which will be live streamed at heritage.org.
All right. I wish you the best of luck. One last question. I wonder if frankly, I wonder if they're going to ban green peppers. And the reason I ask that is the FDA has given themselves the right to regulate tobacco products, but an e-cigarette is not a tobacco product. It just has nicotine in it, which you can get out of green peppers. I mean, this
tomatoes, eggplants, yeah.
It's pretty arbitrary.
It is pretty arbitrary. And in fact, there are some people that are making e-cigarettes with nicotine that come from other sources. So maybe the convoluted idea is that e-cigarettes contain nicotine, which comes from tobacco, and therefore it is a tobacco product. I guess that makes gasoline with ethanol a corn product.
Well, my free market mind thinks if they quit manufacturing these things, if they drive them underground, you're going to be getting them from China and places that aren't regulated. They're going to be purchased on the black market, and they're going to be ultimately more dangerous than the ones you can get at a store that sells e-cigs and vaping products.
That is true, and some people will just not want to risk it, not want to go through the trouble, and they'll keep smoking the deadly old product.
I'm looking at your bio here at nationalcenter.org. That's where the National Center for Public Policy Research rests on the web, and I can get you back on the program and talk about fracking and all kinds of stuff. Wow.
Let's do it.
I think we should make it a date. All right, I'll have my producer. My people will call your people, Jeff.
Thanks, Gary.
Thanks.
Always a pleasure.
Take care. Jeff Stier with us from the National Center for Public Policy Research. It's the Gary Nolan Show, the Zimmer Radio Network.